Hey everyone, welcome back to another installment of Discussions with Dr. G. I'm Dr. G, your guide, occasional cynic, and unapologetic lover of coffee and cat memes. Today we're getting straight to the heart of what community and public health nurses actually do, beyond just checking blood pressures and handing out pamphlets. Though yes, we do plenty of both. So let's get our definitions right, because even some nurses mix up these on exams. Community health nurses, or CHNs, are sort of the boots on the ground folks. They're out there giving direct care, running screenings, linking people to the resources they need, and my personal favorite, educating literally anyone who'll listen, sometimes in the middle of the county fair, surrounded by toddlers, tractors, and I kid you not, one suspicious cat owner who wanted to know if cats can get high blood pressure. Still, never got a good answer for her, but that's okay. Public health nurses, or PHNs, think a bit bigger. Their scope covers things like epidemiology, looking at policy, disease surveillance, the prevention side of things, the zoomed out, let's stop the next outbreak crowd. Honestly, it's less about fixing one person's problem and more about attacking the why is this a problem for everyone question. But here's the kicker. Both CHNs and PHNs use what's essentially the same nursing process: assessment, diagnosis, planning, implementation, and evaluation. Except this time, the patient is your whole community. Instead of charting notes on Mrs. Smith's wound, you're asking, what's making our town's diabetes rate skyrocket? That's population-based care, and trust me, it's a game changer once you reframe your thinking. So yeah, same nursing process, but you're writing the care plan for the whole zip code. Just don't try to fit all of that onto a single care plan. It's not pretty. Now, before you can fix anything, you gotta know what's broken, right? That's where assessment swoops in. And let me tell you, assessment in community health isn't just about numbers. It's about stories, smells, and if you're doing a windshield survey in summer, a whole lot of sweat. Say you hop in your car, cruise the neighborhood, and jot down what you see. Are the yards clean or are they cluttered? Is there a playground? Is there broken glass? Then start talking. Community forums, individual interviews, sometimes random chats over grocery carts. Alongside these, we've got the cold, hard data. That's the census numbers, health stats, everything from hospital admission rates to local crime trends. Blend it all, and you've got a picture of what your community is truly facing. But if you want to keep things organized, you use models like the social ecological model, the one that reminds you that we're all impacted by stuff that's way beyond ourselves. Friends, culture, policies, the whole shebang. Or maybe you use the change model, which is everything your type A heart could want. An 8-step methodological march from collecting the numbers all the way to action planning. Or zoom out even more, and you're talking about the Community Health Needs Assessment, or the CHNA, where everybody, yes, even that grumpy pharmacist, has a voice in what matters. Now, I'd be remiss not to talk about partnerships. You can't do this alone. You need gatekeepers. Think school principals, clergy, sometimes that one parent who knows absolutely every family on the block. Community health workers. I love these folks. Local experts too. These people are paid, or maybe they're not, but they're absolutely critical bridges. Schools, hospitals, churches, they're your anchor institutions. You want sustainability? You involve them. Reminds me of the time I teamed up with Pastor Lewis, who could fill a church hall on Tuesday with just 3 phone calls and a promise of homemade pie. If there's one thing I learned, it's that partnerships move the dial way more than lone wolf heroics. All right, shifting gears. Let's talk about what actually happens during outbreaks or when you're targeting health priorities and trying to figure out if you're making a dent. Epidemiology. It's not just a big word to impress people at parties. It's the science of who's getting sick, why, and what can we do about it before it happens again. When we talk nationally notifiable diseases, stuff like TB or measles, this is there's this little thing called the NNDSS, right? That's the National Notifiable Disease Surveillance System, where the state requires you to report these cases. PHNs are often on the reporting end, tracking cases, working with disease investigators. Your CHNs are out there doing screenings, education, connecting folks to care. If you're ever knee-deep in an outbreak, you're not just swabbing noses and calling labs. You're at the hub of a whole info wheel, talking with epidemiologists, food inspectors, and the folks in daycares, sometimes all at once. So you got to set priorities. Money is always tight, and that means you have to prioritize. Tools like the NCLEX method, nominal group planning, criteria weighting. These are just fancy way of saying, let's make a plan without fighting. Sometimes it's as simple as colored sticker voting. Sometimes you're crunching numbers. My personal favorite is seeing a room full of stakeholders argue over colored dots. Honestly, it's democracy at its quirkiest. But even after picking your battles, program planning's got to be systematic. Strategic prevention framework. Yeah, it's a mouthful, but basically it's a circular dynamic and big on teamwork. Okay? Once the plan's rolling, don't stop. Evaluate. Performance measurement is the are we doing what we said we do step. Well, program evaluation asks, is it working and should we keep funding it? Remember, you've got to communicate these results to the public. Tell your story. Make it snappy. Use real stories. And remember, people want progress, not a stats lecture. That's it for today's episode. Next time, we'll get even more practical and maybe a little bit more sarcastic. It depends on the coffee situation. Take care. Keep asking the uncomfortable questions. And remember, community health is everyone's business, even your neighbor with the suspicious cat.